Hi, everyone. Thank you all for joining. My name is Rachel Ong, and I'm the Regional Coordinator for Global Fund Advocates Network Asia Pacific. I'm based in Singapore. I'm now going to hand over our moderation for this campaign launch to Dr. Kwati Haiwan, who is a very esteemed activist and distinguished speaker also in our region based in Hanoi, Vietnam. Wan, over to you.
Thank you very much, Rachel, and good morning, good afternoon, everyone. It's lovely to be in this space again for the next replenishment campaign. We all know that we are in a very strained time. I would say it's a very challenging time, but it's a time that I guess more than ever that bring people together, and we need to be together. To start with this event, let me introduce Jennifer Ho, who is the Operation and Governance Strengthening Officer at the Global Fund Advocate Network Asia Pacific, to do some housekeeping rule. Jen, over to you.
Great, thank you so much, Juan. Thanks, Rachel, as well. Good afternoon, good morning, colleagues. Just a few housekeeping announcements. A kind reminder to please mute your sound when the session is going. It's happening and you're not speaking. And again, this session will be recorded and made public. GFAN AP will publish a blog summarizing the event on our website later on. And please do feel free to introduce yourself to each other in the chat box. A kind reminder that simultaneous interpretation is available in French, Bahasa, and Hindi. So to select your preferred language, click on the translation button at the bottom of your Zoom screen and choose your language. And to help accommodate a translation, we do kindly ask the speakers and participants to speak slowly. And feel free to share your comments and reactions in the chat box. We have set aside some time throughout the session and we'll respond as much as possible. And lastly, we'll be taking a group photo at some point during the session. If you prefer not to have your photo made public, please do feel free to turn off your video. And that's all from my end. Line over, back to you. Oh, yes.
Thank you, Jennifer. And so let me just quickly go through the objective of today's event. So today we get together and I see an impressive number of 100 participants in this event. So it shows how much interest the community and civil society have in the replenishment of the Global Fund. The Global Fund is now more than ever is a critical life for many of us, so many of organizations. So a successful replenishment, Eighth Replenishment is critical for many of us, for millions of people living with HIV and key affected population. So for today, first we would this event is hosted by the Global Fund Advocate Network, Asia Pacific and Africa. So we bring two regions together. So I hope that first we can connect the two regions, Africa, Asia Pacific, and also other key stakeholder, constituency member, the technical partner, the CCM member, etc. So first is about the connection and dialogue. So second is that we, through this, you will get information about the Global Fund, more information about the Global Fund as replenishment. So the key timeline and activities, what's going to happen between now and the conference, the replenishment conference, where the donor will announce their commitment for contribution. The third objective is for the Global Fund Advocate Network Asia Pacific to launch the campaign. So for every replenishment, we have a campaign to advocate for the Global Fund. So this is an official launch of the the GFAN AP replenishment advocacy campaign. There be the presentation of the key message to the campaign so that we can all speak with one voice when it comes to mobilization for the Global Fund. And the fourth objective is to provide an update on the complementary effort for the replenishment campaign by the other region and platform. So today we hear from other people, other college about what some of other network and platform are doing for the replenishment. So these are the 4 objectives for today's event, and I hope that everybody will enjoy it. And at the end of the event today, we can be all happy that we achieved the objective. Hope so. And I'm sure with everybody's commitment. So with that, let me now to move to introduce Blessy Kumar, who's the chair of the Global Fund Advocate Network Asia Pacific, to deliver her opening remarks. Blessy, over to you.
Thank you so much, Juan. Good morning, good afternoon, good evening, everyone. Depends on where you are joining from. It's really amazing to see such a huge number of people joining this. And as the chair of GFAN AP, it's my honor to welcome everyone on behalf of the GFAN AP Steering Committee. So very, very welcome and greetings from all of us. So the process for this started sometime in August when 30 civil society and communities joined together to deliberate on the Global Fund replenishment and the campaign that we wanted to have from our region, and to formulate also the key themes for a successful campaign leading to a successful replenishment. And the slogan, "More now than ever," has a very remarkable and immense meaning at this time. And it is more so now. We have witnessed the impacts of recent withdrawal of donor aid and hope that this slogan will really resonate well and ensure support for a successful replenishment. I would also like to, at this time, take a moment to acknowledge the efforts of communities and civil societies across the world, but also very specially in the Asia Pacific region. This commitment, as we gear up towards the pledging conference, and we hope will result in a very successful replenishment as well. I also want to note that 19% of Global Fund investment between 2021 and 2024 are from our region, the Asia Pacific region. And with renewed commitment and strong civil society and communities, we hope that it will only increase. We believe that Global Fund partnership is powered by the pursuit of equity and the belief that no one should die from preventable and treatable diseases. And we all align to that. And that is extremely important. And lastly, we need to join our efforts so that we are able to and must be better together, as the Global Fund is important for communities affected and civil society who work for that across the world, even more now than ever. I wish our meeting every success, and hopefully we will go back enriched and also with a renewed commitment of working towards this goal. Thank you very much.
Thank you very much, Blessy. Yeah, this more than ever now we need strong commitment, and more than ever we need to stick together, to work in solidarity and in collaboration and coordination. And I'm so pleased to see that for this event, is GFAN Asia Pacific and GFAN Africa is coming together to do this. So it shows that, yeah, more than ever, we are all in it together. So let me introduce our speaker from Africa, from GFAN Africa, Olivia Ngul, who is the key person at CS for me, Civil Society for Malaria, but also from GFAN Africa. We'll speak on behalf of GFAN Africa to welcome everyone. Olivia, my hero.
Thank you, my sis. Thank you all for joining this event. We are especially thankful to GFAN Asia Pacific for inviting us as GFAN Africa to join this campaign. We are in a moment of unprecedented health challenges, as you all know, but we really believe this is the time for us to join forces, communities from Asia, from Africa, from anywhere in the world that is still affected by those three diseases. It's really time for us to join forces even more, to be stronger, to be coordinated in our efforts, and to join our voices to really ensure that we continue this fight and we end those epidemics. As you know, more than us now is the time to really increase the funding that we need for malaria, TB, and HIV. And we also take this moment to celebrate the impact of the Global Fund on the three diseases, saving more than 16 million lives and more, and doing way more than that. So the Global Fund for all of us is not just an institution, it's not just, a bad number, but we all know the real impact of the Global Fund at the community level. Day to day, when the women, the children, the men have to go and take the test and treatment, we know what that means for them. And as civil society organization, we know exactly the impact of the Global Fund, and we know that we have to be successful this year, despite all the challenges, because it has a huge effect on our communities, which is our brothers and sisters, our families. So we are really happy very happy, very honored to join this campaign with you, to work stronger and to ensure that we will continue to save more than 20 million lives if we have a successful replenishment. So thank you, Asia Pacific, for inviting us to co-join this campaign, and really thank you for all the civil society organizations. I see a lot of Francophone also who join, and Anglophone from all the parts of Africa. So it's time we meet and greet our colleagues from Asia Pacific. We strategize together, we work together, and we really tell our global leaders that we will not stop until no one is dying from those three diseases. So thank you again for the invitation.
Thank you so much, Olivia, and I'm so glad that we have a Francophone and Anglophone and colleagues from different part of the world joining. Bonjour and merci beaucoup. And for next, we will have the chair of the board with us, Lady Roslyn. I don't think I need to introduce her further. She's such a noble lady who's so committed to the key population to end HIV, TB, malaria. Lady Roche would love to be here with us today, but because of other overlap commitment, and you can imagine in her position these days, how busy, how tight her schedule has been. But she managed to record a video for us. So now we will hear from Lady Roche on the video. Yeah, please.
Dear colleagues and friends, I'm very sorry I can't be with you live today, and I hope that my amateurish home video works. It's a privilege to join you for the launch of the More Now Than Ever campaign. I want to thank GFAN Asia Pacific and GFAN Africa for bringing us together for this launch. I want to acknowledge the incredible leadership of Rachel Ong, Rosemary Mburu, and Olivia Ngor in driving these regional communities and civil society-led campaigns forward to complement and support the efforts of the Global Fund Eighth Replenishment. I also extend my deep appreciation to our partners from civil society whose efforts are instrumental in advancing the fight against HIV, TB, and malaria. Finally, I want to recognize the tireless advocacy of networks of people living with and affected by the three diseases, key population organizations and regional champions who continue to mobilize political will and resources. Your commitment is crucial to ensuring a fully resourced eighth replenishment of the Global Fund. As you all know, the Global Fund was born out of bold political commitment and global solidarity. More than 2 decades later, this partnership has saved 65 million lives, cut the combined death rate from HIV, TB, and malaria by 63%, and helped build stronger, more resilient health systems in over 100 countries. But today, progress is at risk. Multiple crises, including climate change, conflict, economic instability, and attacks on human rights and gender equality, are deepening inequities and placing the most vulnerable at even greater risk. The eighth replenishment is therefore a pivotal moment. Our goal is to mobilize at least $18 billion to save 23 million more lives, prevent 400 million new infections, strengthen health systems and pandemic preparedness, and ensure equitable access to life-saving interventions. This investment is not just about ending 3 diseases. It is about delivering economic resilience, social stability, and a healthier future for all. Every dollar invested in the Global Fund delivers a 19.1 return, generating an estimated $323 billion in health and economic benefits between 2027 and 2029. I encourage all of you to study the investment case available on the Global Fund website. It presents a compelling case for how we can end AIDS, TB, and malaria as public health threats. I'm pleased to be joined today by colleagues from the Global Fund Secretariat. You will hear more from Françoise Vanny and David Traynor later, but I encourage you to reach out to them and to others in the external relations and CRG teams at the Global Fund for further engagement. To make this replenishment a success, we need all of you. Your advocacy is more crucial now than ever before. What can we do? What can you do? Engage decision makers. Governments must prioritize investments in the Global Fund and in health systems. Mobilize domestic resources. Countries must increase their own investments in health to complement donor contributions. Amplify the evidence. The impact of Global Fund investments is clear. We need to share success stories and highlight the return on investment. Keep communities at the center. Those most affected by HIV, TB, and malaria must be at the heart of decision making and of program implementation. Your voices amplify advocacy and impact. Strengthen political will. Health is not a privilege, it is a right. We must push for bold leadership and sustained financial commitments. The Global Fund has never stopped at anything to fight these diseases, and we can't stop now. Every voice, every action, and every investment brings us closer to a world free from HIV, TB, and malaria. This event is about bringing people together from communities, civil society, and key partners across Africa and Asia Pacific to strengthen our collective voice. We're here to raise awareness of the Eighth Replenishment, plan our advocacy, and focus on community, rights, and gender. Today also marks the launch of GFAN Asia Pacific of the More Now Than Ever campaign, reinforcing the urgent need for continued investment. Let's work together to ensure that the Eighth Replenishment is fully funded. Let's protect the gains we've made and accelerate progress towards health equity, universal health coverage, and a safer world for all. Thank you.
Thank you, Lady Rose. And I know that it must be a, I would like to congratulate Lady Rose for making this video, and she said it's homemade video, amateur. So you could see that how much effort she had put in this to make sure that she's here with us, at least in the video, and deliver the message. And what I beside on the number that Lady Rose mentioned, 23 more million people to be saved, 400 million new infections to be prevented if we manage to raise 18 billion for the replenishment campaign. But I also, what struck me is what she said, and I hope everybody remember what she said. Every voice, every action will take us a step closer to end HIV, TB, and malaria. So everyone's count, every voice, every action will take us a step closer to ending the three diseases. So that's I think the message is very clear that nobody is too small. No action is not important. So let's work on this together. In the remark of Lady Rose, she also mentioned François Vanny, who's the head of the External Relation and Communication Division at the Global Fund. So this is the department that at the front line of replenishment, and François, more than anyone, knows the replenishment inside out. So François is going to give us some highlight of the Eighth Replenishment campaign. François, nice to see you. Bonjour, over to you.
Thank you so much, Juan, and everybody for organizing this call, for inviting us, and for joining. I see a very large number of participants, and I'm very, very pleased to be able to engage with you today. Bonjour à tous et à toutes. So I'm going to share with you a brief update on the launch of the Eighth Replenishment that happened a few days ago, starting with an acknowledgement that we are indeed in quite unprecedented times and very challenging times for global health, for the Global Fund, and for global development more broadly. Yet it's very inspiring to see that all of you are on the call today because we have a job to do. And we have a very, very important replenishment to run, where I would say that the Global Fund is more now than ever important and vital for many, many communities around the world. So the slogan of the GFAN campaign could not be more appropriate given the times we're in. So we can go to the next slide. I will share with you a few highlights about the launch of the Eighth Replenishment campaign, which took place in Johannesburg, South Africa, a few days ago. The objectives, as you know, when we launch a replenishment campaign, is really to secure a political buy-in, to start our resource mobilization efforts, and to communicate the investment case and the ask that we are going to run the replenishment campaign with. So without details, and if we can go to the next slide, I can highlight with you how it worked out. It was condensed, compressed event compared to what we may have done in the past. We had to go to a virtual format to allow for high-level participation in the current context. But I think it was very successful in bringing together the voices of the Global Fund partnership and in showing how the Global Fund is and needs to remain a reliable partner for countries and communities to fight HIV, TB, and malaria and strengthen health systems. So on the picture, you can see the big two pictures are two co-hosts. So we were extremely pleased to be able to announce that we have two co-hosts for the Eighth Replenishment campaign. One is South Africa, and you can see the Minister of Health at the left end of this slide. And then the second co-host is the UK with David Lamy on the screen as well. And it's really important to bear in mind that we have those two co-hosts throughout the replenishment campaign from the beginning to the end. And we are extremely grateful for their commitment and leadership. We also had voices from across the partnership. As I said, on the picture, you see ministers of health from Malawi, from Indonesia, from Nigeria, from Central African Republic. You can see obviously also a number of very important voices from civil society, communities, and also youth who was also represented at the event. And we had a number of donors also and partners represented. On the picture, you can see the Minister for International Development from Germany. So overall, a very good show up and level of engagement and a representation of what the global partnership unique model looks like. So we were quite happy with that. Next slide, please. So what we did at the replenishment launch was to launch the investment case. Lady Rose and other colleagues have already mentioned the importance of the ask that we launched there. The Global Fund needs $18 billion, which is the same amount as last time. And with that, if we are successful, which we hope to be, we would be able to save 23 million lives. I'm going to skip probably the next two slides to be able to go more into, directly into the key messages. In terms of all the data points that the investment case contains, I very much encourage you to look at our website. The investment case is a very big, very comprehensive document, but you also have an executive summary, and then you have versions at a glance in multiple languages, in French, in Spanish, in Korean, and in multiple languages. So hopefully you can have some tools there that are helpful for you to familiarize yourself and support the replenishment efforts. The key headlines are that with $18 billion, we'll be able to save 23 million lives, also avert 400 new million infections or cases, and very importantly for our donors, deliver a return on investment of $19 for every dollar invested in terms of health outcomes, but also broader economic and social outcomes, which turns out to be a very important argument for our donors in a moment where, as you know, they are facing all sorts of challenges, political and fiscal challenges. The return on investment resonates well with them, alongside, of course, the very compelling numbers in life saves and infections averted. Next slide, please. So we did that virtual event, successfully announced the co-hosts, announced the investment case targets, explained all the rationale around that, and all sorts of very compelling voices coming from both countries and communities benefiting from the support of the Global Fund. So all of that was great. I would say it was, in that sense, successful. The co-hosting was warmly welcomed by all of our partners and stakeholders. The investment case also was well received, and we heard a number of very firm commitments from donors and partners to continue supporting the Global Fund despite the constraints. There was a very strong also a message coming out from that meeting around the Global Fund being a reliable partner, a partner of choice, very unique, and a partner that stands with you at all times, through crisis, through challenging times, through unprecedented circumstances, a reliable partner. So I think that's really, really important. We also heard a number of messages in support of the multilateral system and the importance of the Global Fund as part of how do we work together as a global community, and alongside some calls for reforms to make sure that we are not taking a business as usual approach, which of course we all know we can't do business as usual and we need to adapt to changing circumstances. And in terms of the key themes might be important as you think about your own campaign as well. Many themes were highlighted by partners around sustainability. How do we ensure that progress is sustained? How do we ensure we continue to boost domestic resource mobilization for health? Obviously, communities, rights and gender were areas where many of the donors and partners emphasized the support and the commitment. Private sector engagement also came up as an important area. And you may have seen that as part of the 18 billion asked, we've also asked the private sector to contribute up to 2 billion out of the 18 billion. So a very ambitious ask that will be very important also to count on your support to make happen. Next slide, please. I'll say just a few words, next slide, on the campaign, which has been a very interesting exercise this year for us, in the sense that we knew we had to be ready for every moment. We knew that the world was changing all the time at a incredible speed. So this is one of the things that we sort of anticipated. And since last year, we knew we had to have a very flexible, adaptable, and responsive campaign. So this is how we are dealing with it. It's a campaign that it's a little bit unusual. Perhaps you may have witnessed yourself that during the launch we were perhaps not as noisy as we would have been in normal circumstances. We were very mindful of the impact of the recent decisions by key donors on the ground, and we thought it wouldn't be too appropriate to be extremely shiny and noisy. So we've sort of calibrated the level of noise. And also one of the key important things to bear in mind is that we are tailoring our campaign messaging to different countries, audiences, and moments. And we need to continue to tailor and adapt as we go, while of course keeping the core arguments that are in the investment case and in the Global Fund's values and mission and strategy, obviously. But that's one of the key things. And perhaps we can have a look at the two next slides just to give you a flavor of how it looks like. It's really about the resilience of the Global Fund partnership. Whatever happens, we are there. We are supporting communities affected by all sorts of disasters or crises. Next slide, please. And in all circumstances, we really keep the hope, the determination that have characterized our 20 years of work. So it's a very, I would say, determined and hopeful campaign in obviously very, very sobering circumstances. Next slide. Yeah, we'll probably shift this one as well. I'll skip this one, thank you. As I said, you have all the information, etc., available on the website. We are very much focusing on the 23 million more lives to be saved as a key headline across the social media channels to make sure that all the audiences focus on the impact as more than on the number. But we will, as I said, adapt, tailor, and evolve as things move forward. Next slide, please. So next step, very important to share with you, because it is only the beginning of our campaign. And we are so happy to see that GFAN, Asia Pacific and Africa are joining forces with a beautiful campaign again this time. So the key milestones are, as always, the launch. So that's now behind us of the replenishment effort. And then the pledging conference, which as usual, is planned for September, October. TBC, we don't know exactly when, nor do we know exactly where. So don't make assumptions in terms of the co-hosting. We don't know yet. And we will work very closely with both South Africa and the UK to determine the best moment and place. And in the meantime, obviously, in between those two milestones, we will be leveraging alongside you, civil society, community partners and advocates, all the critical moments, regional moments, global moments, where we can make noise and secure support and pledges for the Global Fund. Next slide. So in terms of next step from our side, we are obviously coordinating closely with the two co-hosts to think with them how we maximize this time between now and the pledging, and how we can together work our donor outreach to secure the pledges in between now and the pledging conference. So that is just it is just starting literally. We are in very intense, I would say, dialogue with donors and partners on the investment case and the Eighth Replenishment ask to secure both the conversion of the current pledges in the current cycle, but also obviously for the future. As I speak, our executive director is traveling to Japan. And we will be, meeting all of our key donors over the next few weeks, and also working very closely with you to leverage, as I said, all the key global, regional, and other events and platforms ahead of us. One of them is, for example, the G20. South Africa has the presidency of the G20, so we hope to be able to leverage that platform to make the case for the Global Fund replenishment. And obviously, we are in very close coordination and collaboration with GFAN and all of you, and we are extremely grateful for that. We'll be attending and participating to the strategy meeting in April. Next and last slide. Your slogan is more now than ever, and I would say that applies very much to the role of civil society and communities-led advocacy. More now than ever, it would be really, really important to count on your collaborative efforts and your voices in elevating the need to continue the fight against those three diseases. We are not done yet. We cannot stop. We cannot get, I guess, desperate, and we cannot give up, because things are not easy, and we know that. In the different countries, the recent impacts have been quite dramatic. So we know that, and that makes, I think, this replenishment and this collaboration with all of you even more vital and important. So I'll stop there, thanking you all very, very much for your engagement, your participation today, and back to you, Juan.
Thank you very much, Françoise. It is a very challenging time, but I guess if for all of us here, if you want an easy job, we will be doing something else. So we have made the choice to do a difficult work. So that's why you are here. So we have a challenge ahead of us to deal with. But I believe that as long as we stick together, as long as we fight hard, we work hard, we get somewhere. And I think nobody else to address that message more clearly than young people. So let's hear from the young people from ICA, who is a regional coordinator for Youth Lead, about the importance of investment in community and civil society. So let's just hear from you, Ika.
Thank you so much, On. Good morning, afternoon. As On mentioned, my name is Ika Novianti. I'm the regional coordinator of Youth Lead, Yankee Population Network in Asia and the Pacific, and also part of the 7 Alliance. Can you help me to project my slides? So it is an honor to speak before you today on the topic that is central to our fights against HIV, TB, and malaria, the importance of investing in community and civil society. as in this challenging situation, now more than ever, we must unite and strengthen our voices to successful global fund replenishment. Next slide, please. So why focus on the key and vulnerable population when we're talking about the HIV, TB, and malaria? In this region, the HIV epidemic disproportionately affect key population, especially young people aged 15 to 24 years and their sexual partners. In countries like Cambodia, Indonesia, Laos PDR, Myanmar, Philippines, and Thailand, nearly half of new HIV infection occur among young people. Persistent stigma and discrimination hinder access to prevention and treatment services, particularly for key population. Criminalization of behavior associated with key population impedes effective HIV response. And also adequate funding and resources are essential to sustain the scale up of the three disease prevention and treatment programs. While progress has been made in addressing HIV in Asia and the Pacific, significant challenges still remain. Continued effort to reduce stigma, reform punitive law, and increase investment for the HIV, TB, and malaria programs are crucial to achieving global health goals and ensuring equitable access to care for all affected population. Next slide. When we are talking about the three diseases, the communities play a crucial role in global health and the work of the Global Fund itself by ensuring the health response are people-centered and inclusive and also effective. Our involvement spans multiple areas, including policy, influence, service delivery, advocacy, and also accountability. In many parts of Asia, stigma and discrimination against key and marginalized population, including people who use drugs, sex worker, LGBTQI plus individual, remain significant barrier to access essential health services. Punitive law and policies further restrict their right and safety, preventing them from seeking the care that they need. Most countries in the region also criminalize drug use and possession for personal use, while sex worker also remaining illegal or highly regulated in ways that increase vulnerability rather than offering protection. Strengthening human rights-based approach and eliminating discriminatory policies are essential to ensuring that no one is left behind in this region against HIV, TB, and other health challenges. For so many years, we know that communities are advocating for inclusive policies and also, inclusive policies. And also they're participating in the CCM to shape funding proposal and ensure resources are allocated effectively. Community-based organization or CBO and civil society group delivering essential health services, especially in hard-to-reach area, providing peer support, treatment, adherence, and counseling, and also other innovative service models. Last but not least, the community play critical role on tracking how Global Fund grants are used to ensure transparency and effectiveness, participating in community-led monitoring to identify the service gaps, report stock out, and push for improvement work as the watchdog organization to hold the government and donors accountable. I think as the youth organization, we must say that Global Fund is the only one donors are really accountable for their communities, because they allow us as community to be sit as the board member and also the other ways channel to track how the fund is allocated for all of the communities. Next slide. So the conclusion, failing to invest in communities and civil society comes at a tremendous cost. Without resource, social movement lose momentum, essential service collapse, and vulnerable population are left without support. Democracy weakens, inequalities widen, and hope are diminished. At the time when global crises are testing our collective strength, cutting back on investment in civil society is not an option. It is a risk we cannot afford to take. So now it's time for the bold commitment. The government must allocate sustained funding for grassroots initiative and also flexible investment. And international donors must also ensuring funding reach to closest to the challenge for the local organization, youth leaders, and community-based movement. So yeah, let us not wait for another crisis to remind us of the importance of community-led solution. Let us move forward, not just with commitment, but with concrete action. Because when we invest in community, we invest in health, human rights, and future free from HIV. Thank you so much. Back to you, On.
Thank you, Ika. We should not wait until crisis to know the role of the community. And now, since we are in crisis, it's more than ever, the roles of community and civil societies even become more important. So, as I can see around me, we don't just sit and cry or scream, but we take action to fight, but also to ensure that our friends, our colleagues, our brother and sister and community member continue to get treatment, continue to be supported. So Global Fund has been a biggest supporter of civil society and community. So by working with the Global Fund for this critical replenishment, I think it's about helping ourselves, helping our community and the people we care the most. So I think with that, I know that we are a little bit behind the schedule, but I allow one burning question or comment. If you have a burning question or comment, please raise your hand. We have 2 minutes before we move to the group photo. So any burning question or comment? Otherwise, you can type it in the chat so we will pick it up whenever we have opportunity. But anyone who would like to speak for 2 minutes? Yeah, I see Mona Balani. Mona, please turn your mic on and speak.
Hi, Kun. How are you?
Hi,
Good afternoon,
Mona.
all,
Yeah,
and
nice to see you.
namaste. And once again, a very big thank you to all GFAN team to organize this dialogue for the next eighth replenishment for the Global Fund. So I just want to know, like being a national community partner or being a civil society partner, how can we prioritize our advocacy priorities? Because in presentation we have seen like still we have to reach the target to access the human right based services and the gender equality and equity for the health services. So what will our priority messages for this replenishment? So I just want to know for that, so we can involve more and more in each and every consultation and dialogue with the communities and other political partners and leaders. Thank you.
Yeah. Thank you, Mona. And I could see Rachel smiling because it shows that you care deeply. Mona, you care deeply about this replenishment. You are ready to take action, as the Lady Rose said. But that will be addressed in the next part of our agenda. So a little bit later on, Rachel will share with you the key message and the key priority for this replenishment. You'll be happy to see that.
Thank you, Con.
Okay. Yeah, great. So with that, I think it is now the time for the group photo, I could see that Hussein have a question. Please keep putting your question in the chat. At the end, and our next speaker will please look at the chat for the question. If you can address the question in your presentation, please do. Otherwise, we will try to say a few minutes at the end to address the question. So please do type the question you have in the chat box. So, but just to make sure that everybody have enough energy for the next part of the agenda, we can have a small 5 minutes health break. In the agenda is 10, but please take 5, then we have more time to discuss and for question. So 5 minutes, and you can grab a coffee or to go to release yourself or have a quick smoke. Yeah. So we are back at in 5 minutes, wherever you are. So yeah. See you soon. I go and grab some coffee. In the first part of the agenda, we have seen the overview. We have the Lady Rose address us in the big picture. We have Francois share with us the highlight of the replenishment campaign. We have Ika to talk about the importance of investment in civil society and community. So we have a quick overview. Mona just reaches so nicely to the next section. So what are we going to do? What are the key message? What are the key priority? So that is exactly what we are going to talk about in the next section. So first of all, let me introduce Rachel Ong, who's the coordinator of GFAN Asia Pacific. For many of us, Rachel is not a stranger at all. So she's been working on the HIV and the Global Fund forever, as far as I could remember. So Rachel is going to introduce a More Now Than Ever campaign. Rachel, over to you.
Thank you, everyone. Just give me a second while I pull out the right slides for this. I'm working across devices, so just do bear with me. First of all, I'd just like to thank everyone for taking time to join us out of their busy schedules. I think it's really comforting given these moments that everyone's able to get together to share the information or to join us for this really important session. So first of all, I'd just like to start off with what we've done in the past as GFAN Asia Pacific. You'd see on the screen, and many of you actually have been part of the process as well. We've actually had in the Sixth Replenishment, which now feels like a lifetime long ago. With Love More, Give More, Heroes Give More, and the Thank You campaign that was coordinated after the pledging conference hosted by President Macron not so long ago, 6 years ago. We've then actually, for the 7th Replenishment, which was hosted by the United States, launched a campaign in Extraordinary Times, The Power of More. I'm not going to go into more details with the campaign video. For then, you can actually find that also on our website and our YouTube channel. But this was a campaign that was devised during the COVID-19 pandemic as we were coming out of it, and there was so much focus on health. The background of this campaign, More Now Than Ever, was meant to actually emphasize that sense of urgency. So this is a snapshot of some of the processes that we've undertaken that led us to the finalization of this campaign. And so I would like to thank all of you and many of you that are here also with us during this launch that partook in various steps of this formulation of the campaign, including the campaign working group. I see that Duncan is there with us. I see Afra is also on the webinar with us. So thank you all of you for sharing your thoughts, your ideas in terms of what would work the best for our campaign. I'm going to go into a little bit more about the messaging angles. We wanted to be able to ensure alignment in our communications, and we wanted to emphasize that appeal to responsibility with donors, emphasize an appeal to the partnership, be able to emphasize impact as well. This huge sense of urgency because we don't have that many years left to 2030. Appeal to the goals and commitments made. Be able to get to people's emotions because people at the end of the day, most of us anyway, are human beings, and we wanted to appeal towards collective security. There are major considerations that many of you know. This campaign and even the investment case for the Global Fund was devised and derived before some of the withdrawal of donor aid happened. So we do see that there are major cuts in the funding and development landscape, and that there is a growing sense of fatigue from donors regarding the messaging of more. But we wanted to be able to emphasize that when we talk about more now than ever, it's not only asking for more money, it's that we can do so much more together. It's because there's so much more that we should be doing, and there's so much more that's left to do. I am then going to show all of you a very short video of the campaign video that we hope to launch now. So do bear with me while I pull this up and share the screen with you to give you more of an insight about the campaign. So this is also the first time I'm seeing this. I saw the work in progress yesterday, but then this is the first time I'm seeing the finalized video. So thank you. I just want to really appreciate Ken and the team for getting this executed and done in such a nice way. I'm just going to move back into the previous slides in terms of what we plan to do. So Mona, I hope this addresses some of your questions and how you can engage with us in the next couple of slides. I think given the current environment that there are restrictions in terms of some of the work that GFAN AP will be able to continue doing across social media. There would be instead very targeted approaches in terms of how we are actually going to advocate to donors, both traditional, non-traditional, as well as emerging and the private sector and philanthropy. But we will still try to use our social media platforms to actually emphasize the amazing work that the communities and civil society have been able to accomplish so far with so little. There would be also opportunities that will look at using press, media, and news portals, forming even more strategic partnerships with the different stakeholders that have not been engaged so much in the past regarding Global Fund resource mobilization. We will be actually updating regularly our landing page for this website for this campaign, the more now than ever. So please keep your eyes peeled for the website page. We'll be also holding regular webinars as well as sessions online to engage and provide updates and messaging, etc. to all of you, including a more detailed webinar in the next week regarding the investment case and what this means for our advocacy work. So some of the campaign assets that we hope to roll out would be videos that we would actually engage many of you from communities, from parliamentarians, decision makers around the More Now Than Ever campaign. There will be supporting videos that will be released throughout. We are actually planning one with many of our malaria partners in time for the Apalma Summit that will be held in Bali in June this year. We'll be rolling out social media toolkits with guidelines, tools, visuals, and messages that will help you amplify your messages at the country level. And we'll also be providing some physical collaterals throughout the campaign. The way that we're approaching the work that we'll be doing to maximize impact and collaborations will be maximizing further collaborations with existing partners, both with GFAN Africa, with GFAN, as well as with our colleagues also from the MENA region. We understand that there have been conversations with many of our colleagues in the Middle East and North Africa regions regarding being able to advocate for the Global Fund, but to ensure that resources do come back to the communities in these regions. So we do want to maximize collaborations with all these partners, with our key population partners, with our partners that work in TB and malaria, as well as in this region and also beyond. We'll be engaging all of you as much as we can. We do hope you bear with us. We are a really small team at GFAN Asia Pacific with 3 of us who are not all, and 3 of us are not full-time, but we would want to be able to work with you to complement the work that you're doing and to support you in any way possible. We'll be engaging in political platforms. We'll be working very closely with our African as well as our Japanese colleagues around TCAD, with our South African colleagues around the G20, etc., to be able to bring the voices up further and make sure that they're being heard. There will be cross-cutting themes. There are certain words that I've actually blacked out for this presentation, but please do be assured that we are standing behind a lot of you in terms of all our key messages around key populations. We'll be looking at cross-cutting issues around the environment, around PPPR, SRHR, looking at the shrinking civic space and advocating for equal rights, looking at gender equality, global health as a public good, and more importantly, as we're seeing as the withdrawal of funding in this current landscape, domestic resource mobilization. So you would have seen in the previous video that we are using stars for this campaign. The explanation was in the video, and we do hope that this resonates very well with you. In the past campaigns, we've actually had 1 week where we had mobilized many of you, and thank you all for all your engagement in the previous years. which have actually been heard by capitals in the capital cities of donors. This time, we're not going to be folding cranes or elephants. We're going to be folding paper stars. And in this, we're going to be able to write messages in some of the stars as they are going to be delivered to the donor embassies in your countries with very, very key messages. We will be doing very targeted letters and statements throughout the year in the next few months to very specific donors with very specific languages. And we'll be sharing what they are with many of you for your feedback and to be able to share with you why some of the messaging is being framed that way before you actually conduct the advocacy work in your country. We'll be holding some embassy events with some of the partners. Some of you we've been in touch with as you have expressed interest in doing something with a donor embassy in your country that is actually friendly and able to take the lead. But in this sense, we're also, as GFAN Asia Pacific, going to be targeting and looking at some of these events that can be led by the private sector and philanthropy in country and not only donors in embassy countries. So this is a calendar of events. They're not all that we're going to be engaging with, but just to give you a sense of how busy the rest of this year looks. We'll be also sharing regular updates about some of the things that we're going to be planning to be doing in the coming weeks. And we hope that you're going to be able to share or join us in this event. On behalf of GFAN Asia Pacific and all our partners, I really appreciate and thank you for your dedication, your commitment, and especially your solidarity in these very, very difficult times. So over and back to you, Juan.
Thank you very much, Rachel. Do you anybody have any question for Rachel now? I will give 2 minutes for now. If there's any immediate question for clarification, yeah. Yeah. Otherwise, I'm sure that GFAN AP will have a video to teach us how to form the star. So I promise I will try. I'm not very good at that, but we'll see. We can have a star folding competition. Yeah, there's a couple of questions in the chat. Rachel, do you want to respond to it now, or you want to wait until the end? So
I think I'm going to just address some of the questions,
yeah.
but I'm not going to answer them because they're we had actually hoped to be able to launch this campaign, and we understand that this is being launched in a very, very difficult moment where many of you might be actually not only facing cuts, or where many of you I've actually had many sleepless nights over the last few weeks because many of our colleagues have been out of jobs. We've also seen many of our friends or heard stories about people not being able to access treatment, not only in our region, but across Africa. So, you know, the numbers are huge. 5,000 community health workers out of jobs in some African countries, et cetera, et cetera. It's actually very, very devastating. But in these very, very difficult times, I find, and being an activist and advocate from the late 90s, which is not an indication or giving away my age, but it's a huge opportunity to set the stage for what we want as advocates in the work that we are doing. So I'm going to leave it as that. There are some questions that might not be appropriate for us to be able to answer during this session, but we'll be able to, we'll take note of these, and we'll get back to people in some of our follow-up sessions, as we are also having conversations on the side regarding some of the withdrawal, the aid withdrawal by certain countries. So
Yeah.
I will leave some of these questions are very specific regarding funding opportunities to colleagues that may be from the Global Fund Secretary at this point. If they're not able to answer at this point, maybe we'll be able to organize something afterwards in terms of a follow-up webinar around implementation and Grant Cycle 8.
Okay. Thank you, Rachel. Yeah, you can just put the question in the chat box, like some of you are doing already. Some question I could see that's very difficult for anybody to answer. Some question may need somebody else to respond, but some question is we can, I mean, there could be conversation either after, I mean, in this section or after. But keep asking question that you have, so at least we know what you are concerned about. And we will try to address that together one way or another. So we have heard about the STAR, about the Asia Pacific campaign, and on the other continent, our African college are very, very active as well, very energized and organized. And I am sure that many of us, I do, many of you also know Rosemary. She doesn't need further introduction. In fact, is super active in everything, particularly the Global Fund, but also in global health in different aspects. So Rosemary is the executive director of Waki Health, but also one of the key person at Global Fund Advocate Network Asia Pacific. Rosemary is going to speak about the share with us the takeaway from the preparatory meeting and the next step for the Eighth Replenishment campaign. So Rosemary, over to you.
Thank you so much, Juan. Very nice to see you. Good morning, good afternoon, colleagues. Yeah, so I'm based in Nairobi, and together with Impact Anti-Afrique, we coordinate GFAN Africa. Olivia, my colleague, spoke at the beginning. So these are highlights from GFAN Africa side in terms of what we heard from the investment case launch, and Francois already did the presentation. And so I'll make reflections from communities and civil society side, given that GFAN Africa had an opportunity to also host a strategy and planning meeting at the sidelines of the launch. And before I reflect on, it's going to be about 5 points, I want to congratulate GFAN AP for the launch of More Now Than Ever. And we are looking forward to participate, to collaborate on this very much. So I think one of the things is to recognize that we do have a Global Fund partner country in an LMIC that hosted the launch of the replenishment and is going to be a co-host for the replenishment. And that's important for us as communities and civil society from, allow me to say, implementing countries or Global Fund partner countries in LMICs, in terms of showcasing and working with our leadership to spotlight the value and the impact of the Global Fund partnership in implementing countries. The other thing is to say that it is very clear, and all the speakers have mentioned that this is a very critical year. It's unprecedented. The challenges are many. And so, and one of the questions, we've been hearing after the launch is, are we going to meet that target? Do we have a plan B? And when we did the GFAN Africa conversation in the lead up to the launch, one of the things we agreed is that we don't have a plan B. We actually don't have a choice. We really have to work so hard to meet this target. And so we are going all in without a plan B, because we really have to rally, to mobilize, and to ensure that we really speak in support of global solidarity. I think bringing our voice to say, what has global solidarity meant for us as communities and civil society? What has it meant for our countries? And why is global solidarity needed now, more now than ever? The second point then is to say, but if that is how we are moving forward, how can communities and civil society noise be quiet? We are used to our noise being loud. We are used to being, putting everything in the flash, in the open, being colorful. We bring color and all that. And so a more quiet and targeted advocacy is what we are looking at right now, and it's what our approach is going to be. And so what that means for us is that we are going to need to be very coordinated. We are going to need to be very, to look into collaboration, more now than ever. Collaboration as communities and civil society across the regions, which is why as GFAN Africa, we are so delighted to partner with GFAN AP, even in the launch of More Now Than Ever. We are going to need to be collaborating and coordinating also with advocates in G7 countries, in donor countries, which is why also the collaboration with GFAN is going to be very important, but also the Global Fund Secretariat. For us to be successful in a quieter campaign, we really have to listen to the intel. We need to listen to what is the right timing for whichever action. We are going to really need to say, how do we ensure that it's targeted and it's not undoing the gains, and that the campaign is helpful. So I think that's also something, for us, we picked from the launch of the campaign and from the approach that we are going to be using in this particular campaign. And the next thing is to say that the other point is that more now than ever, we need domestic leadership. We need regional political leadership. We need our own government in implementing countries or in partner countries in LMICs more now than ever to step up in being champions for the replenishment, champions for the Global Fund. And what that means is that we want to hear our political leadership speaking up publicly as guided by the Global Fund Secretariat whenever is helpful in support of the impact of the Global Fund in our countries, but also demonstrating leadership from a place of increased domestic investments. And that's something, a leadership that is needed more now than ever, given the current geopolitics, given the current funding landscape. And so we are going to be utilizing our voice and our action, even though in a quiet, in a targeted, in a guided, and in a very collaborative manner, to push also on the domestic investment and leadership point of view. But also the other point is that we need, regional voices, regional action, country voices, country action. In our region in Africa, we are looking forward to working with the replenishment champion countries. So there are a number of countries that the Global Fund is working with, as champions. And I know all the countries, actually, we need all the countries. Like one you mentioned, every country, every voice, every dollar, every minute counts. But there are also some strategic countries that we are going to be working with in terms of their role as champions. And we are looking forward to having, communities and civil society voices, from across the board, all of us coming together to ensure that that voice is stronger more now than ever. And the last thing is to say that I think coming back and closing with the element of global solidarity, noting that each region has its own dynamics. And so as GFAN Africa, we've also had the opportunity to look at the investment case and firm up our campaign. And I know our colleague will be presenting that in a few. But, in this and what will be presented from the GFAN Africa side, it's our call for global solidarity and really saying that this fight is really uniting all of us, because right now we are talking about one world and one fight more now than ever. I thank you very much and hand it back over to you all. Thank you.
Thank you, Rosemary. And I think Rosemary highlight beautifully how each of us need to work, but we need to work together, right? Each country is different, each continent is different, but so we need to take our own activity, we need to take our own initiative, need to take our own responsibility. But we are in the world together, and we can complement each other, we can support each other, because we are in one word and we are in the one fight together. So I think that's Rosemary have introduced very nicely the campaign from Global Fund Advocate Network in Africa. It is One Word, One Fight campaign that Sigolène Musala is going to share with us. Sigolène.
Hi, thank you so much, Juan. Good morning or good afternoon, everyone. I hope you can listen to me. The GFAN Africa Secretariat is very happy to be here and very happy to be part of this launch. My name is Sigolène Musala. I'm the communications lead at Impact Center Afrique, which co-hosts the GFAN Africa network with Waki Health. And I'm going to present our plans in terms of communications for the Eighth Replenishment. So our campaign is really based on 3 pillars. The fact that no country or region can solve the multiple challenges we are facing alone. The fact that progress comes from our collective actions in the fight against HIV, TB, and malaria. And the third one is about the power of partnerships, knowing that communities, civil societies, political leaders, and other stakeholders must collaborate to build a healthier and more equitable world. So it's really based on these 3 reflections that we came up with the campaign theme that I'm going to present now, drum roll. And here it is, one word, one fight. As you can see on the logo, we have the globe first, which is really representing the world we are living in. And then you have the joint hands representing solidarity, global solidarity, like Rosemary just said, unity, and the fact that we are in one word and it's one fight. So this is our campaign theme, and the campaign has a bucket of messages, 4 key messages with sub-messages for each one. The first is about daring to do more, and we have messages like calling all African leaders to act. We talked about action earlier, mobilizing civil society and communities, and putting the spotlight on African leadership. We want to tell more stories about ownership, about how African countries are contributing and taking the leadership on their own health. The second one is about increasing funding for the fight against the tree disease, both global and domestic. And we have key messages about domesticating regional commitments and frameworks for the African region, and increasing and sustaining domestic funding for health. The third bucket messages is leaving no one behind, health as a human right, the spotlight on community leadership, and investment in health services for vulnerable populations. And the last, but not the least, is keeping communities at the center of everything we do. And then we are going to have a lot of activities about sharing impact stories, the impact of the Global Fund on the ground, and investment for more sustainable and effective solutions. So here are the 4 key messages we have in the One Word, One Fight campaign. And as for the key moments, you can see all the activities. We are not going to have activities for all the key moments, but these are the ones we identified. And coming soon, we have important dates like World Malaria Day and World TB Day. We also have the TCAD, which are key moments we need to collaborate and have some activations on. And I'm also seizing this opportunity to share that in coming weeks, we are going to host 3 important events. First, we are going to launch officially the One World, One Fight campaign on March 11, because for now it has just been a soft launch. But on March 11, we are really going to unpack everything about the campaign, unpack all the messages, share the resources that we have prepared for colleagues, targeted letter templates, videos, social media posts, and printed materials, everything. On March 19, we are going to host a special parliamentarians briefing on the Global Fund investment case, and parliamentarians from other regions too are welcome to join. And on March 27, we are going to host a special youth forum to engage the youth in what we are going to plan this year. So these are the 3 key next events we have, and we are going to share the links and the save the dates very soon in the listserv. The last slide is really about collaboration and synergies. It's true that we have 2 campaigns, more now than ever, and one word, one fight, but it's for the same objective. So we noticed a couple of things. The first being that our 2 campaigns share the same core messages, which is now more than ever, investing in the fight against the 3 disease is crucial. Lives are at stake. The second one, our 2 regions face similar challenges with some differences, but the challenges are similar, and together we can create a really strong advocacy momentum to ensure a fully replenished global fund. And starting now more than ever, we are calling on everyone to work together on joint mobilization, on common messages, on shared advocacy tools. Please, when you have activations, digital activations, use both more now than ever and one word, one fight hashtags. And last, GFAN Africa and GFAN AP must work hand in hand, because a bold global fund replenishment is most likely to succeed through strategic and united mobilization and solidarity. And I'm thanking you on this slide and on telling you that you are our secret weapon. So we are really counting on communities to make their voices heard for this replenishment. Thank you. Over to you, Juan.
Thank you very much, Ségolène. I love the picture of the secret weapon. So we are on the secret weapon. So we let's. I think what Ségolène shared with us is really nice. And don't forget that whenever you post it on Twitter or Facebook or LinkedIn or anywhere, do both hashtag. One word, one fight, and more now than ever. So it's really beautiful to see the 2 continents working together, because we are really in this together. So now we have heard from GFAN Africa, we have heard from GFAN AP. Now we will hear from GFAN, the Global Fund Advocate Network, the one who collaborate with different advocate network for the Global Fund. Quentin is going to give us some update about the replenishment campaign. Quentin, your 5 minutes start.
Yes, thanks a lot, Owen, and I'm glad that you took on the role of having to explain the difference between the 15 different GFANs out there. So hi everyone, my name is Quentin. I work for the Global Fund Advocates Network, and I'm here instead of our director Katie, who is sick. So you can move on to the next slide. So a bit of context. So in December 2024, we were at a meeting in London, and Global Fund staff that I will not name was sharing that it always feels this way, but this will be the hardest replenishment yet. And oh boy, it didn't get much worse since. So we knew already in December that we were facing cuts to ODA across key donors. We knew that a number of them were in the middle of political chaos. That's true of France since summer 2024. Canada is in the middle of an election season. They don't know yet when the election will be, but there are some really scary candidates running. Germany just dodged a pretty big bullet with election results from last week. So we knew it was going to be hard, but then it went from difficult to an acute emergency after Trump took office, and we knew it wasn't going to be friendly to aid. We knew it wasn't going to be friendly to global health. But I don't think anyone foresaw how bad it was going to be and how quickly it was going to get this bad. And I will add that it got bad with the executive orders and the suspension of funding. But the recent sort of comments around Ukraine and NATO are really will have all sorts of effects down the line that are extremely concerning, especially for European donors, which are now scrambling to spend more money on defense. They will need to take that money from somewhere, and likely they will be cutting through aid budgets. So yeah, it's absolutely the hardest yet, and it's really concerning. Next slide, please. Thanks, Ken. So I'll be very quick on this one because Rosemary stole all of my talking points, which I really appreciate because that will help me be faster. But as she said, in a context where there's so much uncertainty, there's so much movement constantly, it's essential for advocates in donor and implementing countries to be talking, to making sure that your work isn't undermining theirs and theirs isn't undermining yours. So that means if you intend on putting together and putting forward an ask towards a donor country, reach out via one of the GFANs, for example, to colleagues in that country to make sure that you are aligned or understanding what the context in that country is so that you can guarantee impact. So that's really the key message from this. Coordinate with your colleagues across donor and implementing countries. Next slide, please. So we'll talk very briefly about the investment case because some of our work has been focused on that. So it came out on the 18th of February, which is a week and a half ago. And we had put out last year a document called S8 Ask for the Eighth Replenishment, and we were making a number of asks and demands to Global Fund Secretariat. We're overall quite happy with the document. We think it's a strong document. It's got a lot of very useful language, a lot of very useful data. It's very credible, which is really important in the current context. We are happy with the target that is ambitious. We thought before we knew that everything like the US funding was likely to collapse, we thought the 18 billion target was insufficient. We think that even more now. But we also understand the rationale for putting that target forward. But we are regretting that the Global Fund legitimizes a funding gap in their model. We are happy to see that there is language around fighting back against shrinking civil society spaces at a time where there is more and more unfriendly governments to civil society engagement. We're also happy to see that there is strong language around climate change, but on both sides, we feel like on fighting back against civil society shrinking spaces, we feel like there used to be stronger language, and we regret that it's been pulled back a bit. On climate change, we wish there had been a bit more work on quantifying the impact. So these are like a few negatives. What we're extremely happy with is the framing of sustainability. We knew that the Global Fund was under a lot of pressure by donor countries to push sustainability as a way to justify cutting fundings, especially in middle-income countries, which is really important, in particular in the AP region. But that's not at all how it's been framed. It's at the center of the arguments that are being made, but very much framed as the real sustainability comes from impact. It comes from ending the diseases, and we really appreciate that, and we think it's important to remind donors of that. We appreciate the centering of partnership across different global health organizations, of innovation and contribution to UHC. We know in particular that UHC is extremely important to our Japanese colleagues. We really appreciate that it was put forward. Next slide, please. So that'll be the end. I'll just very quickly cover some of our tools. So unlike our colleagues in Asia and in Africa, we are not yet ready to launch our campaign, but I can give you a quick sneak peek. So we'll relaunch almost 10 years after the Here Am I campaign. For some people on the call, they will remember that was how GFAN was initially started in 2012. So the idea is to really highlight that communities are experts, and they were able to build that expertise. They were able to contribute thanks to the work of a Global Fund and the millions of lives that it has saved in the past 20 years. We hope that will resonate with everyone, even some quite unfriendly governments, and it will be launched in the next couple of weeks. In terms of the tools we have for around to support you with your advocacy, there is a link at the bottom left to the full page, and I'm putting that same link in the chat. It's got some thoughts on the investment case, some ways to compare the current investment case with previous ones, social media assets, including thank you for the co-host, which complement some of the ones that have been put out by other partners. And generally, that page will be where you'll find a lot of our additional work in the next couple of months around the replenishment. In the interest of time, I'll stop here. Thanks, everyone.
Thank you very much, Quang Tang. And I think it's really nice that the GFAN's already working on the investment case and make it easier for us to present the investment case, to share the investment case. So that's really great. We are almost at the end of our section, and I just want to show you what is in my bag. I don't know if you can see it clearly. It is a star, actually. That is one of the product that we, one of the things that left from the 7 replenishment campaign. So for the 7 replenishment campaign in Vietnam, we mobilized the community to fund 18,000 paper crane for $18 billion target that we did. And then we made it into the map of different donor country and the heart and star, and we kept one star in our office. And now it become the symbol of the next campaign. And you can see Rachel is holding a jar full of paper crane that we present this jar with paper crane to different people that work so hard for the campaign. So Rachel got one. So we are going to form the star and 18,000 star.
Quang also has one.
Okay, so we are now at the end of our section. Let me introduce the 2 co-hosts to close the section today. So Rosemary for GFAN Africa first.
Thank you so much. I think it's really just to say thank you and to say that this has energized us, I would say, and very happy to hear how we are moving forward, to see so many colleagues on the call interested to be part of this campaign, to be part of this cause. So I think all I can say is here I am, more now than ever, one world, one fight. I look forward to us doing this together and to reaching the targets. Thank you very much.
Thank you so much. And Rachel, for GFAN AP.
I want to thank all our participants and especially all of you for taking your time out of your busy schedules. I know there were many very difficult questions in the chat box. We hope we were able to work with you to answer some of them or at least address them. We do understand that many of these are actually issues that you need to work out within and in your countries. I do want to thank the GFAN AP team that's been working so hard over the last 2 or 3 weeks. There has been a lot of travel, there's been a lot of back and forth regarding the language that we're able to use. But I thank everybody for accommodating my bad temper sometimes, or most times, and working with us throughout this. Thank you so much to GFAN Africa for actually working even more closely with us. The partnership with GFAN Africa is not a new one. It's just that we've been able to find even more areas of complementarity, even more areas of working more even stronger together and more closely together. And so we're looking very much forward to even better outcomes in this replenishment. I want to thank Juan. Thank you so much as the former chair for GFAN Asia Pacific for taking this on such short notice as well, and being such a strong advocate for the Global Fund and also around community issues and civil society. Thank you again to the translators. I know this is not easy given the multiple languages that we're working with and the speed that we're speaking at. But last and not least, all of you, especially to our speakers as well, and those that are not here, as well as Lily Ross and Francoise who's left. Thank you so much, Ika, for being here with us and sharing all the very important messages. We'll be in very close touch with many of our country partners going forward around specific actions that can be taken in your countries in the Asia Pacific, in very close collaboration with our other colleagues in the other regions. And as Pauline, who's with us at a very
Rachel, you are on mute.
You stop at us, Pauline. You're with us.
Pauline said, sorry, I don't know. I don't know what I pressed. I was getting very excited. No, but as Pauline once said, like 6 years ago, that the work that we're doing across regions, across different organizations for the Global Fund may not always be aligned, may not always be alike. The ways that we do things are not alike, but we're always aligned in terms of the work that we're doing, in terms of the final outcomes. So thank you so much for your solidarity. And we're here with you in terms of such difficult times. So it's one world, one fight, more now than ever. Thank you, everyone.
Thank you, everyone. And more now than ever, we'll be touching again soon. Okay, so if you can